Hi, my name is Jessica Nelson, and this is my personal philosophy of healthcare. Just a little bit about me. I have been a nurse for 3 years now, which isn't a long time, but I had a career change in the process. I have worked mostly on a medical surgical area, dealing primarily with surgical patients. So I guess you could say that's kind of my world. I threw in some pictures here just for entertainment purposes. So, to begin, as nurses, I believe that we are obligated to be the patient advocate as well as the patient cheerleader. This means supporting patient autonomy and providing the education necessary for patients to make medical decisions. As nurses and as future nurse practitioners, we also need to make sure that the education we provide is backed by the most current evidence. Another thing that accompanies being a patient advocate is ensuring that our patients are safe at all times and keeping them away from harm, as well as considering the safety of our coworkers and ourselves. There are times when patient safety and autonomy seem to conflict, when we know that patients are not making the best possible decision. This is where it is really hard at times, and I have learned that the best thing we are able to do is try and educate but also allow them to make their own choices. Trust is another huge topic, as this often determines whether or not the patient will listen to you or respect you. I personally feel that establishing trust is one of the most important parts of nursing, as many patients are often scared in medical situations, and they truly rely on us to provide the best possible care and advice. At the same time, I also believe that we must trust our interdisciplinary team as well if we are going to ensure that our patients are receiving the care that they need. Lastly, I believe that accountability plays a huge role in the entire medical field. All people must be held accountable for their actions, as we often have so many layers of workers backing the treatment of one patient. If a medication error has passed by the physician, the pharmacist, and the nurse, we should all be held accountable. At the same time, if a perfectly coherent patient cannot follow rules or policies, they also need to be held accountable for their actions as well. Getting into the policy, this is kind of a hard topic to discuss, not knowing what the future will bring us right now. As of current, the Patient Protection and Affordable Health Care Act is not perfect, but I do agree that everyone deserves the chance to have medical coverage. I still believe that deductibles are very high, and I do not agree that those who do not have health insurance should be penalized for it every month. Another important aspect is that most insurance companies have a list of covered providers, not allowing people to choose their own. Even though more people have access to healthcare, I'm not sure that the quality of care has improved at all. Another issue that we find a lot in my workplace is that many patients do not understand insurance requirements. For example, patients are told when meeting with their physician that they are slotted for a 3-day stay after having a knee replacement. What they are not told is that if they meet all requirements for discharge on day 1 after surgery, they are required to go, unless they want to risk insurance not covering their stay. This is something that comes up all the time at our hospital, and I once had a patient tell me that we do not take into account the emotional readiness of our patients, when really it all comes down to insurance, and I do agree, but bottom line is insurance coverage in most cases. In the end, I don't want to sound like a negative person, but the medical world is a very complex place, and I really don't know that we will ever find a perfect system, but I really hope that we can. Getting into the legal aspects, this makes me think about our scope of practice, our license requirements, state requirements, and the issues of negligence and malpractice. As nurses, we are held to certain standards, and it is our job to protect our patients and provide them with quality care. This goes back to being the patient advocate and really speaking up for our patients when we are concerned about their health and safety. We obtain certain certifications and learn about orders that should be made so that we can help our team make the right decisions for our patients. And lastly, also very important that we keep our patient information confidential and do not allow their information to slip out. And the one last thing that I want to add, this is a picture of Memorial Hospital. I don't know if anyone has ever read the book 5 Days at Memorial, but whenever I'm thinking about ethics, this book comes to mind, as this is a hospital that completely ran out of all resources after Hurricane Katrina and had to make some very tough ethical decisions afterwards. And it's just a very interesting book to read. Kind of makes you cringe, but also makes you wonder what you would do in the same situation. So just wanted to throw that out there. Thank you for listening.